Hi everyone, my name is Zhaoyuan and I go by Nick. I'm a PhD candidate in the informatics department at the University of California, Irvine. On behalf of my co-authors, Yunan Chen, as well as our clinical collaborators, Dr. Sunil Kamath and Dr. Pornchai Tirakitsoontorn from the Children's Hospital of Orange County, I'm excited to share our work titled Creating Safe Places, Understanding the Lived Experience of Families Managing Cystic Fibrosis in Young Children. Imagine the happiness of welcoming a new child into the world, only to have that joy interrupted by a serious diagnosis. For families of children with serious chronic genetic conditions like cystic fibrosis or severe sickle cell disease, this challenging situation becomes their new reality. From that point on, their lives are significantly changed. Parents often need to take on the role of full-time caregivers, managing a complex schedule of treatments, medications, and hospital stays. They must find a balance between the important responsibility of managing their children's health and the desire to provide them with a normal and happy childhood. The emotional impact is significant. Stress, uncertainty, and worried about their children's well-being becomes part of daily life. HCI research has studied how families care for children with serious chronic illnesses. Much of this work has focused on a specific age group, primarily infants or teenagers. There's a lack of understanding of parent-child dynamics in managing serious chronic illness in young children, as well as knowledge about the transition throughout the developmental changes occurring in this age range. We aim to bridge this gap in knowledge by exploring the unique experiences of family caring for young children aged 6 to 13 with cystic fibrosis, a genetic disorder that progressively impacts various organ systems and currently has no cure. We chose to focus on cystic fibrosis for two key reasons. First, as a genetic lung condition often diagnosed at birth, it provides a lens into evolving parent-child dynamics of illness management and the shifting roles and responsibilities as the children grows. Second, its progressive nature and demanding daily treatment regimen, which can last 2 to 3 hours every day, involves a comprehensive routine of medications, therapies, and lifestyle modifications, require parent and children to continually adapt their management strategies, presenting a unique opportunity to study how family creates and adjusts to their new normal. Our goal is to give voice to the experiences of this family and shed light on the complexity they navigate daily. Through their stories, we hope to inspire more compassionate, child-centered, and family-oriented approaches to supporting children with serious chronic illnesses and their parents. To gain a deep understanding of the lived experience of family caring for children with cystic fibrosis, we conducted an exploratory study in partnership with the Children's Hospital of Orange County. I was fortunate to be onboarded as a clinical associate at the pulmonary clinic, which allowed me to closely engage with the healthcare teams and build rapport with potential participants. Over the course of 6 months, I attended the weekly clinics, including 13 in-person and 3 telehealth visits, building trust with the clinical team and creating a comfortable environment for families to learn about my research. I conducted an in-depth interview with 12 families, including 12 children and 14 primary caregivers, providing a platform for them to share their daily routines, health management strategies, technology use, challenges, innovative workarounds, as well as positive experience. Throughout the 6 months data collection period, I used qualitative memos to capture emerging analytical ideas and insights, noting factors such as the temporal pattern of the illness, child developmental milestones, and family values as significant influences on the health management of cystic fibrosis. Once data saturation was reached, my co-author and I inductively analyzed the subset of transcription using reflexive semantic analysis approach. We identified broader themes centered on stages in family's journey, and I analyzed the remaining transcripts with the research team meeting regularly to discuss coding and ensuring consistency. Our study revealed that parents of children with cystic fibrosis often begin their journey with a shocking and emotionally charged diagnosis at the child's birth. Parents describe this moment as traumatic and one of the life moments you'll never forget. Compounding this distress was parents' lack of familiarity with CF, a less prevalent condition compared to other pediatric illnesses. Many found themselves thrust into a demanding world of rigorous care and relentless treatments, often feeling unprepared and overwhelmed. The pursuit of clarity from healthcare providers did not always provide relief, as some parents received outdated information from general practitioners who lacked specialized CF knowledge. In their anxiety, many turned to the internet for answers, only to find themselves more confused and distressed amidst the dodge of information. Following the distressing diagnosis, parents entered an intensive period of actively managing their child's health while simultaneously strive to cope with and comprehend the disease. This demanding phase primarily spanning infancy and the preschool years, a time when children are wholly dependent on their parents. Parents sought guidance from specialized CF team, which provided invaluable medical advices and emotional support. However, they often felt the need for more personal strategies to handle the day-to-day challenges of managing CF at home. To bridge this gap, parents turned to online health community and social media groups, connecting with experienced CF peers for practical insights and creative solutions. While strictly adhering to medication and therapy protocols and maintaining hygienes, each parent crafted unique health management approaches tailored to their own preferences, belief, and specific family situation. Parents employed diverse strategy to manage their children's CF, influenced by their beliefs, preference, and unique family circumstance. These strategies encompassed various facets, including social activities, school choices, and parental employment. Some parents prioritized maintaining hygiene and limited their children's participation in perceived risk-prone activities, while others thought a balance between safety measures and offering their children fulfilling life experiences. Similarly, school choices varied, with some families opting for homeschooling or private institution to minimize health risk. Others preferred public school to cultivate a sense of normalcy. Parental employment choices also differed, with some adjusting their career to accommodate their child's CF management, while others maintained their work to instill a sense of normalcy in their own life. Notably, these approaches were not static but evolved, reflecting the parents' ongoing assessment of their children's needs and changing priorities in family life. As children grow older and become more curious, parents cautiously involve them in health discussion and management. This stage typically begins around ages 6 to 8 years when children's maturing cognitive and linguistic capabilities enable them to better comprehend their surroundings. Parents gradually introduce their children to the reality of CF through constructive dialogues, aiming the deepening of children's understanding of the disease progressively. They employ two key approaches, using a storybook as a medium and engaging in proactive, spontaneous discussions. While attempting to involve children in CF discussions, parents often communicated cautiously, avoiding the disease distressing aspect to prevent burdening the children with negative details at a young age. In addition to facilitating constructive discussion, parents gradually introduce their children to health routines, typically around the age of 8 to 10 years, when children increasingly showed interest in their health management. Parents perceive this phase as an ideal window to support their child's sense of responsibility and self-sufficiency. They introduce various CF management tasks, such as using home-based therapy machines, employing phone alarms for medication reminders, and engaging in weekly pill sorting activities. As children assumed increased self-care responsibilities, a subtle shift emerged, with children progressively sharing responsibility in their CF routines. However, given the serious and progressive nature of CF, parents consistently oversaw everything to avoid errors and ensure safety. Older children around the age of 10 to 13 years expressed a desire for more autonomy in their CF management. However, parents remained deeply involved as a precautious measure, given the significant implication of non-adherence to therapies and medication when it comes to a progressive condition like CF. While encouraging their children to take on more tasks and responsibilities, parents meticulously oversaw details to ensure error-free care. They recognize the inherent drive for independency as children grow, but emphasize the need for vigilant supervision due to CF's progressive nature. Parents aim to strike a balance between fostering their children's growing independency and maintaining a watchful eye to ensure their safety and well-being. This collaborative dynamic underscored the importance of equipping children with the skills and knowledge to become more self-sufficient while providing the necessary potential guidance and support. Our research highlights the importance of considering child developmental milestone as a pivotal macro-temporal factors when studying and designing for chronic illness management. We trace the journey of families managing cystic fibrosis from birth through early adolescency, revealing how stages of child development intersect with changing roles of parents and children. This macro-temporal perspective, spanning from infancy to the end of pediatric care, offers a unique lens to the understanding of the long-term progression of the disease and the evolution of health management practices. Recognizing and accommodating these multifaceted and co-evolving changes of both children and parents is crucial for the successful design and implementation of health technologies and services. We emphasize designing health services and technologies attuned to the emerging skills and interests at each stage, while easing transitions can promote children's autonomy and facilitate the journey toward independent self-care. Our study revealed that every parent prioritized creating a safe place when managing their child's CF. However, the interpretation of safe place varied among families, reflecting the parents' individual values and beliefs about what was right for their children. We emphasize on how parental value plays a pivotal role in a child's health and well-being. While standardized treatment for CF may exist, the intricacy of daily home management reveals significant variation, reflecting each family's unique circumstances and parental values. Moreover, these values are dynamic, adapting in response to various factors, from exposure to new information to the growing needs of the children. And our study underscored the importance of recognizing and accommodating families' values when designing digital health technology for children's health management. Supportive technology should feature customizable interface tailored to a family's illness journey and values, adapting and providing relevant information and resources to match their changing circumstances. These systems should prompt parents to define their values and priorities, connecting families with communities who share similar values for added support, and maintain relevancy over time by detecting shifts in users' behavior and allowing families to adjust priorities as their values evolve. For instance, a parent who values cleanliness could be provided with sanitization guidelines and best practices, while one who values social activities might receive recommendations on how to participate in social events safely. As children mature, parents readjust and recreate a safe place by involving their children in CF management. Our research highlights how parents guide their young children transition from dependence to understanding and actively managing their health, balancing the introduction of CF topics without distressing details and fostering a collaboration while ensuring precise care. We emphasize the potential of the developmental window, age 6 to 13, as a prime opportunity to create child-centered and family-oriented technology that support parent-child interaction in managing a serious chronic health condition like CF. This system should provide a safe place for children to explore, learn, and build self-efficacy while guiding parents on when and how to introduce age-appropriate disease-related content. For example, a system could offer interactive storybooks or game for younger children, transitioning to video-based content for older children to address more complex aspects of the condition. This child-centered digital-mediated experience could facilitate learning essential disease management knowledge and skills incrementally. Moreover, this system could assist parents in having serious conversations and provide access to additional support resources, such as consultation with the CF care team, online health communities, or mental health professionals to promote family psychological well-being. As children mature, technological tools could suggest age-appropriate health tasks, allowing children to develop self-management skills over time. This system could track children's learning progress, create family-oriented activities, and inform parents when guidance is needed. By ensuring a safe place for both child and the parents, this system can facilitate a symbiotic relationship, fostering trust, mutual understanding, and the child's well-being. Thank you for listening. If you want to learn more about our research or to connect with me, please feel free to scan the QR code. I look forward to further discussion. Thanks again.